Imagine a silent partnership within your body, working tirelessly to fortify your bones and safeguard your arteries. Many optimize for vitamin D3, the sunshine vitamin, yet overlook its crucial counterpart. Without this partner, the very calcium D3 helps absorb could become a silent threat, depositing in soft tissues instead of strengthening your skeleton. This video uncovers the essential synergy of vitamin D3 and K2, revealing how this powerful duo, supported by key cofactors, is fundamental for true health span extension and robust longevity. You've likely heard about vitamin D3's importance for immunity and bone health. But what if a critical piece of the puzzle is missing from your regimen? Research indicates that without vitamin K2, the benefits of D3 are incomplete, potentially even counterproductive for cardiovascular health. Longevity Lab explores the evidence-based protocols for combining D3 and K2, detailing precise dosing, the role of essential cofactors, and how this powerful synergy can optimize your cellular longevity. Imagine a silent partnership within your body, working tirelessly to fortify your bones and safeguard your arteries. Many optimize for vitamin D3, the sunshine vitamin, yet overlook its crucial counterpart. Without this partner, the very calcium D3 helps absorb could become a silent threat, depositing in soft tissues instead of strengthening your skeleton. This video uncovers the essential synergy of vitamin D3 and K2, revealing how this powerful duo, supported by key cofactors, is fundamental for true health span extension and robust longevity. Vitamin D3, or cholecalciferol, is more than just a vitamin. It functions as a potent steroid hormone. Synthesized in the skin upon exposure to ultraviolet B light, its primary role is to regulate calcium and phosphate homeostasis. Clinical evidence shows that vitamin D3 is crucial for bone mineralization, immune system modulation, and cellular growth regulation. However, the story of calcium regulation does not end with vitamin D3. This is where vitamin K2 enters the picture. Often overshadowed by vitamin K1, which is primarily involved in blood clotting, vitamin K2 plays a distinct and equally vital role in calcium metabolism. It exists in several forms, with menaquinone 4, or negative 4 Malawian kwaches, and menaquinone 7, or negative 7 Malawian kwaches, being the most studied. The synergy between vitamin D3 and K2 is profound. Research suggests that vitamin D3 significantly increases the absorption of dietary calcium in the gut. More importantly, it stimulates the production of specific vitamin K2-dependent proteins, such as osteocalcin and matrix GLA protein, or MGP. Without adequate vitamin K2, these proteins remain inactive. This is where the critical activation step occurs. Vitamin K2 acts as a cofactor for an enzyme called gamma-glutamyl carboxylase, which activates osteocalcin and MGP. Activated osteocalcin then binds calcium, directing it into the bone matrix, strengthening skeletal structure. Simultaneously, activated MGP prevents calcium from depositing in soft tissues, particularly in the arterial walls and kidneys. This mechanism is crucial for cardiovascular health, as arterial calcification is a significant risk factor for heart disease. Therefore, while D3 ensures calcium availability, K2 ensures calcium is utilized correctly, preventing its harmful accumulation in unintended places. This intricate dance between D3 and K2 highlights why supplementing with D3 alone, especially at higher doses, might not be optimal without considering K2. The goal is not just to absorb calcium, but to ensure its proper distribution for health span extension. The scientific literature provides compelling evidence for the D3 and K2 synergy. A comprehensive review published in Nutrients, PMID 3105910, highlighted the combined effects of vitamin K2 and D3 on both bone and cardiovascular health. The review indicated that while vitamin D3 is essential for calcium homeostasis, vitamin K2 is critical for the appropriate utilization of that calcium. Specifically, studies have shown that adequate K2 intake, particularly negative 7 Malawian kwaches, is associated with reduced arterial stiffness and calcification. For instance, a landmark Rotterdam study, an observational cohort study, found that high dietary intake of K2 was linked to a lower risk of coronary heart disease and aortic calcification. While this was an observational study, subsequent interventional trials have provided further insights. Another study, detailed in atherosclerosis, demonstrated that a 3-year intervention with negative 7 Malawian kwaches supplements significantly decreased arterial stiffness and improved vascular elasticity in healthy postmenopausal women. PMID 291411088. This suggests a direct role for K2 in actively reversing or preventing age-related vascular damage. Regarding bone health, the synergy is equally critical. While vitamin D3 boosts calcium absorption, vitamin K2 ensures that this calcium is deposited into the bone matrix. Clinical trials have shown that combined D3 and K2 supplementation can lead to greater improvements in bone mineral density compared to D3 alone, particularly in osteopenic or osteoporotic individuals. This is achieved by activating osteocalcin, which then integrates calcium into the bone structure. Furthermore, the essential cofactor, magnesium, plays a pivotal role in this entire process. A review in Nutrients, PMID 299444243, highlighted that magnesium is required for the activation of vitamin D in the liver and kidneys. Without sufficient magnesium, vitamin D cannot be converted into its active form, calcitriol, rendering supplementation less effective. Magnesium also participates in over 300 enzymatic reactions, including those involved in bone formation and energy production. Therefore, the evidence strongly suggests that for optimal bone and cardiovascular health, a comprehensive approach involving vitamin D3, vitamin K2, and adequate magnesium is not merely beneficial, but essential for maximizing health span. Determining the optimal dosage for vitamin D3, K2, and magnesium requires a personalized approach, ideally guided by blood tests. We will outline 3 scenarios: optimistic, realistic, and pessimistic, to provide a spectrum of evidence-based protocols. Optimistic scenario. This protocol targets individuals with confirmed deficiencies or those aiming for rapid optimization under medical supervision. For vitamin D3, initial loading doses of 10,000 to 20,000 international units, or IU, per day for several weeks might be prescribed to quickly raise 25 OH-D levels above 50 nanograms per milliliter. For vitamin K2, specifically -7 Malawian kwaches, doses ranging from 300 to 500 micrograms, or mcg, per day are often used in research settings to achieve significant arterial decalcification and bone health benefits. Magnesium intake in this scenario could be 400 to 600 milligrams, or mg, per day, split into 2 doses, focusing on highly bioavailable forms like magnesium glycinate or citrate. This aggressive approach requires regular monitoring of blood calcium and vitamin D levels. Realistic scenario. This represents a common maintenance protocol for individuals with adequate baseline levels or those seeking general health optimization. For vitamin D3, a daily intake of 2,000 to 5,000 IU is often sufficient to maintain blood levels between 40 to 60 nanograms per milliliter, especially when combined with some sun exposure. For vitamin K2, a daily dose of 100 to 200 micrograms of -7 Malawian kwaches is a practical target for most adults, supporting both bone and cardiovascular health. Magnesium supplementation of 200 to 400 milligrams per day from food and supplements is generally recommended to ensure adequate cofactor availability. This scenario emphasizes consistency and a balanced approach. Pessimistic scenario. This protocol is for individuals with very low baseline levels, specific health concerns, or those who prefer a more conservative, gradual approach. For vitamin D3, starting with 1,000 to 2,000 IU per day, with re-evaluation after 3 to 6 months, allows for slow, safe increases. For vitamin K2, a minimum effective dose of 50 to 90 micrograms of -7 Malawian kwaches daily can still offer protective benefits, particularly against arterial calcification. Magnesium intake might start at 100 to 200 milligrams per day, gradually increasing as tolerated. This approach prioritizes safety and allows the body to adapt slowly, especially for those sensitive to supplements or with underlying conditions. Regardless of the scenario, it is crucial to prioritize blood testing for 25 OH-D levels to guide vitamin D3 supplementation. For K2, while direct blood tests are less common, its inclusion is generally recommended when supplementing with D3. Always consult a healthcare provider to tailor these protocols to your individual needs and health status. While the synergy of D3, K2, and magnesium offers significant health benefits, it is essential to acknowledge potential limitations and risks. The research on vitamin K2, especially long-term high-dose interventions, is still evolving. Individual responses to supplementation can vary widely due to genetic factors, dietary habits, and overall health status. The primary concern with high-dose vitamin D3 supplementation is the risk of hypercalcemia, or excessively high blood calcium levels. Symptoms can include nausea, vomiting, weakness, and kidney problems. While rare with typical supplement doses, this risk increases significantly with very high, unsupervised intake, especially without adequate K2 to direct calcium properly. For vitamin K2, the main safety consideration involves interactions with anticoagulant medications, particularly warfarin. Vitamin K is essential for blood clotting, and high doses of K2 can interfere with warfarin's mechanism of action, potentially reducing its effectiveness. Individuals on blood thinners must consult their physician before initiating K2 supplementation. For newer anticoagulants, often referred to as DOACs, interactions with vitamin K2 are generally not a concern, but medical advice remains paramount. Magnesium supplementation, while generally safe, can cause gastrointestinal side effects such as diarrhea, particularly at higher doses or with certain forms like magnesium oxide. Individuals with kidney impairment should exercise caution with magnesium supplementation. as their kidneys may not efficiently excrete excess magnesium, leading to hypermagnesemia. Always prioritize a holistic approach, including a nutrient-dense diet, regular exercise, and sufficient sleep. Supplements are intended to complement, not replace, these foundational pillars of health. Regular medical checkups and blood work are indispensable for safe and effective longevity protocols. The synergy between vitamin D3 and K2, supported by magnesium, represents a powerful, evidence-based strategy for enhancing bone density and protecting cardiovascular health. By understanding their intricate mechanisms and applying personalized dosing protocols, you can optimize your body's calcium utilization, moving closer to a longer, healthier health span. If you found this deep dive into longevity science valuable, please like this video and subscribe to Longevity Lab for more evidence-based protocols. Share your thoughts in the comments below. Have you experienced benefits from D3 and K2 synergy? We value your insights.